Okay, so now we're gonna do a gluteal Ztrack injection, intramuscular. The Z-tracks are very safe. They're used a lot more now than they used to be because the medicine is not going to seep back up the needle track. So what you're doing is you're displacing the tissue. So we're gonna push the tissue over, and then we're gonna go in, and when we come out, the tissue's gonna cover the track of the needle, if that makes sense. So it's not gonna seep back out through the skin. We used to use this a lot for iron injections or injections that were necrotizing or really irritating to the skin, but basically intramuscular injections are the way to go that are in the Z-Track method because the safety and the medication. So we're gonna find our space. We divide this into quadrants. We're gonna go in the upper outer quadrant, same dorsogluteal site. We wanna make sure that we know where we're going. I use this as a landmark and I go just below it. So quadrants, upper outer quadrant, right below this line, and fill your space. You could measure it, and you can measure it different ways, but it's all gonna end up in the same area. So we're gonna go ahead and clean it. I cleaned a pretty big space because you're moving the tissue. So intramusculars are always a minimum of a 1-inch needle, depending on the size of the patient that you have. So I'm gonna take this bone and I'm gonna put my body weight into it and push that tissue over. You able to see? Mm-hmm. So this tissue, the subcutaneous tissue is moving over the muscle. The muscle's not gonna move, the subcu tissue's moving. So that's what's displaced. And then we're just gonna go, we have to measure to make sure we can grab this because that tissue has to stay there this whole time. We don't wanna let go while it's in. Let me do this one more time. Oops, there we go. Sorry, babe. We aspirate, inject, counting to 10. So I counted to 10, I'm letting go, pulling it out, then that tissue covers it. We don't massage this site. Oh, that's about it.